for snow. Get some snow. Sleet. That's what I'm thinking. It's going to be sleet between today and tomorrow.
As long as it doesn't ruin my Halloween decorations.
It'll add a little element to them, right? All right, we'll allow people to keep popping in, but we'll get things started. So good morning, everyone. We're very pleased to be here for our first ever virtual State of the State. I feel like first ever is something we've said certainly a lot of times this year. So very glad to be here and pleased to have all of you joining us. So to start with, I just want to thank our sponsors. The Chamber couldn't do the work that we do without their support. Our presenting sponsor is Oracle for today. Supporting sponsors, Bank of America and Eversource. Sustaining sponsors, Bellwether Community Credit Union, Citizens Bank, and Enterprise Bank, and then contributing sponsor, Northeast Delta Dental. So thanks to all of them for sure for helping make our work possible. So we certainly have an opportunity this morning for questions. If you sort of hover over either the bottom or the top of your screen, you should see a Q&A button. So feel free to submit your questions. We'll have time for those at the end, but feel free to submit them as we go along. And let's see from here. Let me see if we have someone to introduce. All right, so Governor, I'm going to introduce you this morning. Not that you, right, I could say the man who needs no introduction. But Governor Chris Sununu is the 82nd governor of the state of New Hampshire, currently serving his second term. And before being elected governor, he served 3 terms on the New Hampshire Executive Council. Governor Sununu is an environmental engineer by trade and a Salem, New Hampshire native who now lives in Newfields with his wife and 3 children. So welcome, good morning. Thank you for being here.
Good morning. Thanks for having me on. Like we're doing a TV show or something. That's kind of the new world that we're in, but it's great to see everybody. I see a lot of faces, which is good. It's amazing that as we've come into this Zoom revolution, I think we all would love to be back in the same room, but sometimes even more people participate over Zoom just because it provides more flexibility, which is kind of an interesting silver lining to where we are. Boy, a state of the state. We all have our own state of the state. I mean, it's been a tough year for everybody, not just, for me and for the government and for what we're trying to do with COVID, but everyone has kind of had to take their own journey, whether it's the anxieties over health issues, dealing with remote learning, the issues in the workforce. First, we had the stay-at-home order, essential, non-essential businesses, 17% unemployment, the $600 stipend came into play, PPP. We can talk about that. We can talk a little bit about the Main Street Relief Fund and a lot of the funding opportunities that we've tried to put out to businesses, the self-employed, the nonprofits. And then as we come back, our economy is incredibly strong right now. Our COVID numbers are rising, as we've always predicted they would. They're actually not rising as fast as I thought, so that's the good sign, but we're getting there, to be sure. They are going up, and we are in this for quite a bit longer. The COVID crisis is not going away on Election Day. It is not going away on January 1st. 2020 will go away on January 1st, and I think we'll all be happy to put this year behind us in many ways. There's been some silver linings on this year, to be sure. There's been some new business sectors and innovation and opportunity that has really sprung up as out of the pandemic. There's some businesses that are doing very well, some businesses that have been hurt very badly. But, as we enter 2021, we're still in this for quite a while. We're in this for quite a few months more, even as the vaccine gets out, as we distribute it. We have a plan. We got a great team. That's all in place, ready to go. We'll have lots of testing and all of that sort of thing. But we're in this probably for another 2 to 6 months at least. And I think, if we have that mentality that this is not over at the end of December, and we whether it's going into Thanksgiving and how we meet with our family, whether it's going into work every single day and remembering to wear a mask and maintain social distancing, they sound so basic and so simple, but those are the things that kept us very successful up until this point. And those are the disciplines and the vigilance that we really need going forward. You hear me say it all the time at the press conferences and in my public speeches that, we really have to stay disciplined. We all have COVID fatigue. We are all tired of this, but we are in it for quite some time. And if you look at what's happening in other states, look at the state, if you will, of other states, it's not good. It's really not. And it's very unfortunate, especially in the Midwest states, the more rural states. Those COVID numbers are flying through the roof right now. Montana, Wisconsin, Iowa, Utah, places like that, the numbers are really, really high, and much higher than they are here. But they were where we are today. They were 6 weeks ago. So if we're not careful, we can end up there. I think I saw a statistic that said South Dakota had 85% of their hospital beds full right now. That's a very scary thought. We have a couple thousand beds of capacity here in New Hampshire. That's a good thing. We only have a few dozen folks in a hospital beds right now. That's a good thing. It's a very low number, but that can skyrocket very, very quickly. And we do have to appreciate we have an older population. We have an older population in our workforce. It's a great thing that they're very skilled, they're very educated, but two issues are happening. Number one, a lot of that older population is not re-engaging in the workforce. They're taking a little extra time. They're staying at home. They're concerned about, the health effects and catching COVID. So they're not re-engaging the workforce. Also, just they are much more vulnerable, right? So maybe it's folks in long-term care facilities or whatever it might be. So there's just a lot of hesitancy there. And I think we have to be very appreciative of that. That's one of the reasons why, we've gotten a lot of people back to work. 3.7% unemployment from 17% in April to 3.7% today. And I don't know anyone who's not looking for workers right now. Everyone is looking. We still maintain far and away the lowest poverty rate in the country, far and away one of the best and highest average wages for our employees in the country. We're ranked as one of the best states in the country in terms of equity and equity pay and equability, if you will, and opportunity that we're providing across the spectrum of our citizens within the workforce. So those are all still very good metrics, very good data points. As COVID just threw a wrench into everything, we just weren't sure where the dust would settle, and it's still settling in many ways. But our economy is strong. We're on a good path, and our COVID numbers are still relatively low. But we are in this for the long haul. Just to take a couple steps back, and I'm not going to reiterate, I could write novels. Literally, I could write novels on what has happened over the past 8 months. But some of the key aspects in terms of how it affects the business community, we tried to be very aggressive, more aggressive than 49 other states, frankly, in terms of taking our CARES Act funds and making them available, not just to the government, but to citizens, to businesses, to employees. We knew the PPP program was very helpful, but also very, very flawed in many ways. For many folks, it's still a loan or a lien on the books. And it would be great if the government turned all of that. They've done some of it, turned it to grants, but they have to turn it all to grants, I think. That's why when we created the Main Street Relief Fund, the first state to do so, other states copied our model, but no state did it as fast, and no state did it with the level of dollars that we have. We're one of the smallest states in the country, yet we still put more money to private businesses than any other state in the country. More than California. The billions that they had, we did more. We did more than Texas. We did more than Florida. They were putting their money to different aspects of the crisis. I think we're very smart, very tight, very restrictive when we had to be early on so that we could flex open at the right pace. And I always say we flexed open at the speed of consumer confidence, because you needed those consumers to understand that there were guidance documents in place, that we did it very strategically, very carefully, in conjunction with our Division of Public Health and Dr. Chan and Lori Shibonette. A lot of folks have gotten to know them very well over the airwaves at our press conferences, but and being very data driven and doing that and having that transparency. We've done a couple things. I think we've built a lot of public trust with what we're doing. Folks are with us. It doesn't mean that what we do is everyone agrees and likes every decision that we make. We know we're making decisions. I make them every day that upset somebody somewhere. That's just the nature of the job and the nature of the pandemic. You got to make very tough decisions. And what we've really tried to do in doing that is play for the long game. We're playing for 2021. We're playing to get our economy back strong at the end of this year, make sure that we don't need to just get bailouts and things like that from the federal government. If they provide stimulus, that would be wonderful. And if they don't, we can manage. We can manage. And my promise, not just to the business community, but to the citizens of the state has always been, we're going to keep vetoing any income taxes that come our way. I'm going to provide a budget that lowers business taxes yet again on the business enterprise tax. I'm going to provide a budget that lowers the meals and rooms tax for the state, again, because in tough economic times, the last thing you should be doing is taking a buck out of the citizens' pockets. And I see folks on the other side. I don't want to get overly political, but one of the contentious points we've had in this last year was, no, the government needs more money. Let's raise taxes. And my stance has been, no, people are going through very tough economic times. We got to make sure they're the first at the trough to get a break, if you will. That's the most important time to give the citizens a break and give businesses a break. And so they can invest in their employees. They can make capital investments and expenditures. So there's a lot of opportunity out there. The stipends that went out were a bit of a disincentive to get people back to work. It had its purpose early on, and I'm not knocking it by any means. I think it had its purpose, served its purpose, and we've moved on from that. So it's not disincentivizing folks from getting back into the workforce anymore, but it did provide a lot of cash into the economy, and people spent that cash in a variety of ways. Strong tourism, strong hospitality, or stronger here than anywhere else. They're still down quite a bit, but stronger here than anywhere else in the Northeast. Really allowed folks to do, whether it's home construction projects or buy cars or all of that kind of good stuff, consumer goods, and they bought locally. They were not spending those dollars on vacations in Colorado and Florida. They were spending those dollars right here in our economy, which has really propped things up very, very strong. And there's a lot of cash out there. We've spent more money on unemployment going out into those that have been laid off over the past 9 months than we have in lost wages of those that lost their jobs. I mean, think about that. Almost $1.5 billion has gone out in unemployment insurance, yet the total amount of wages lost is around 1.2 billion. So that's an amazing statistic in that there's technically even more cash in aggregate out there right now. And then you have the CARES Act funds and all the other government stimulus that has come in, all the hundreds of millions of dollars into the hospitals and things of that nature. So there's a lot of money out there. There's a lot of potential for the economy. It's why people are saving so much, why people are doing so many home consumer type projects. We have the Main Street Relief Fund 2.0 that is out right now. And I think there's still a day, maybe today or tomorrow is the last day to apply for it. It literally takes 20 minutes. We tried to make it the easiest government application in the history of the world. And in doing so, we put out nearly already 350 million, and we're trying to get another 100 million. So when you add self-employment, because we're the only state that did a self-employment fund. When you had the nonprofit fund, we're one of the only states to do that. We're far and away the biggest state to do a Main Street Relief business type grants. That'll get close to $450 million. You're looking at about half of our CARES Act money, almost $600 million, is going to go out in just stimulus and relief and opportunity for individuals, not just for the government. Now, at the same time, we've been able to buy testing materials and buy PPE and spend the dollars on the government side where we need to keep the numbers low and have what we need to have those tools in the toolbox, if you will, to manage through the rest of this crisis. And it is going to take management. You can't sue your way out. You can't lawyer your way out. You got to manage, and you got to build good teams. And for the folks, as part of chamber and business owners and managers that are joining us this morning, you get that. You got to have a team that's in sync, that understands the mission, that understands the data, understands the analytics you're using to make your decisions, so that in concert you can all move together to fulfill on that mission. And at the end of the day, you got to be held to results. I think every elected official, whether they're the planning board or the governor or the president, everyone needs to be held to the results that they've been able to achieve. And so I think we've gotten great results here in the state, not perfect by any means, but I think we've gotten very, very good results considering how at the tip of the spear New England was very early on in this. We didn't panic. We had to make tough decisions with the restrictions. We don't want to go backwards. We don't want to be in a position where we have to close things back up. That is not our intention at all. I suppose it's something we could do down the road if things really got out of hand. But remember, a lot of the restrictions that we did are all done in the name of making sure that the healthcare system does not get overrun. That's what the original goal was, and that is still what it is today. So as long as we have capacity in those beds and the ICUs and the ventilators and things of that nature, we're in a good position. But we have to manage to that, of course. Now, if things get really overrun down the road, 5, 6, 2 weeks from now, 2 months from now, who knows what it's really going to look like? No one knows the future like that. We may have to make other decisions, but right now I think we're in a good place. We're managing well, but we need folks to stay disciplined in the workplace, in their homes, with their families, make those sacrifices. The virus, as I always say, it does not care that you're with Uncle Bob and Aunt Susan for Thanksgiving. It is going to have the same attack rate regardless of how friendly you are with your family. It doesn't matter. And so it's those familiar atmospheres that are really driving a lot of the the expanded outbreaks that we're seeing. And then that trickles back into the workforce. It trickles back into schools and potential closures there. We've had 85% of our schools are open in some fashion, whether it's in fully open or a hybrid model. And I still don't think we don't have any outbreaks. We have cases of COVID with kids here and there, but no full-blown outbreaks or anything like that. So I think the guidance document we put together was phenomenal in that it provided a lot of guidance, a lot of guidelines, if you will, but at the end of the day, really allowed the teachers to have a lot of the flexibility they needed to be successful, knowing that the teachers and the parents and the administrators were the ones to really be in position to make the best decisions, the final decisions, if you will, in that third grade classroom. And that flexibility is what we need. Kids need to get back into school. They should be back into school. It's very important. I know in Nashua, a lot of those schools are still closed, even though the numbers are going up. I personally think that there's opportunity to get those kids back into school. I know there's a lot of resistance with the unions there, but at the end of the day, there's net health benefits into allowing those students to have those opportunities. So, I mean, we'll see kind of where we go. I mean, I could rattle off all the great statistics we have and all that, but I think we're in a good place. But I just want to reemphasize, if we all as individuals, not as just the governor, but as individuals, business owners and managers and folks in our families, stay responsible and vigilant, I think we can still be very successful. And then my sense is there's a stimulus package coming somewhere in our future, probably early 21, maybe February or March, regardless of what party wins. I think you're going to see it in some fashion. And while other states are bailing themselves out financially, we're going to be, again, continuing on that investment path that we've already created. We don't need to reinvent the wheel. We're going to keep investing in infrastructure and jobs and businesses. That's what we've done really, really well, better than virtually anybody since this whole pandemic started. And that's what we're going to continue to do. And that's, I think, what sets us apart from everybody else, not just in New England, but on the East Coast. It's why real estate is booming, why businesses and families are moving in here right now. You know, we're the place to be. And I'm very proud of that. I think we've put the right leadership team together to get us, to design the system, to get this product out. And my job now is to keep the machine going, keep this finely tuned machine nimble, so we can go left or right depending on what might come our way. We have to appreciate that every day that goes by, something else could hit us. It's still 2020, whether it's the toilet paper crisis of April of 2020, and maybe there's future crises to come. We got a great team, and we're going to be able to manage through it. But I guess with that, I can, like I said, I could speak volumes and write volumes on this, but we can open up for questions, or I can go away quietly, whatever you guys like.
So I have a couple questions for you to start with. So I've sort of heard musings as it relates, to restaurants right now, right? We're sort of seeing a little bit of a trickle in, cases here and cases there. Will there have to be kind of a broader decision made at some point if we continue to sort of see these little drops here and there?
In terms of restaurants and further restrictions on restaurants, is that the question? That is not the plan right now. If you look at the data, when folks are what's happening is it gets colder, our immune systems get suppressed, we all go indoors, we're, just a little more face-to-face than we were over the summer, and that's why the numbers are being driven up across the country. With restaurants, we were already indoors, right? So you can look at the models that played themselves out over the summer. Folks were indoors. We're allowing the dividers now. We're still not seeing a lot of outbreaks in restaurants. There were a couple of cases of restaurants just thwarting the guidelines and just being dumb, if I can, and we had to take action on those, and we're going to continue to take action. But if you follow the guidelines, there's no reason, and working with Dr. Chin and his team, we really believe the model works. We can be successful there. One of the changes that I know we're going to be looking at restaurants is the Restaurant Association has asked us to do. It's funny, they're asking us, can you mandate that every time somebody comes in, they have to sign in? And what that really does, and the reason they're asking is, that way we don't have to do as many of the public notifications, because we'll know everybody that's in that restaurant if there were a case. If we don't have everyone's name and information, we have to do this grand public notification, and I know that can kind of freak people out a little bit. So as opposed to having, okay, here's the 14 people that were in the restaurant during the when we know the outbreak was potentially happening, or that evening, we can call them all directly and deal with it in a very strategic and surgical manner, if you will, very specific, as opposed to these broad public notifications. And I think that's something that we're willing to look at. They're asking us to mandate that, and that's one of the changes we're looking to make. But no, overall, we think the restaurant model can be very successful all the way through.
Well, and the media is tricky, right? They serve a very important role and we certainly value them, but I think they take those little pieces and run with them, right? When they hear about restaurants. And so, yeah, I think it kind of creates.
It's a story.
Yeah,
it's a story, to be sure.
So how about the balance between, we've been working with the state as a chamber with these regional partnerships. And one of the components that we focused on is the idea of recruitment. So trying to get people to come to New Hampshire from other places. How do you balance that message with, we want you to move here for jobs, even for tourism, right, to come visit with, our numbers have been better than other places and we want to continue that. How do you balance between those two?
Well, again, I think the model that we found over the summer was very successful. We were very nervous about it. I think the big examples like Hampton Beach. So if you had told me in March or April that we were going to have Hampton Beach open on June 1st, I would have said, you're crazy. There's just no way. But we really worked hard at the model, social distancing, shutting down the roads, expanded seating, all that kind of stuff. And even though we knew thousands of people would come up specifically from out of state, we watched it very carefully and we showed that it can work. And we show that we can have a very successful tourism season without massive outbreaks all across the North Country. We did that over the summer. It can work. So I think by, we took these, I go back to the incremental steps at the speed of consumer confidence. We kind of inched things open carefully so we could look at the data, wait a few weeks, make another step, wait a few weeks, make another step. And that has allowed us to have that balance. But we do want families to move here. I tell them to leave their politics from wherever they came because we just do it different. Like we always have to remind people, why did you come to the live free or die state? Why did you come to a place where there's no income tax and we want to keep cutting business taxes and cutting this and cutting that? Because my job is to have business be successful and get the heck out of your way. I mean, that's my philosophy. And so we got to provide those guidelines and those the safety measures, of course, but then let business do business and provide that competitive aspect between businesses instead of top-down mandates that are overly restrictive. But again, encourages folks to come here, remind them why they came, and I mean everything from the DOT signage on the highway. Yeah, we don't have a mandatory mask order across this entire state. Certain cities and towns do, and that's fine. We support that. But remember, our DOT message is wear your mask, maintain social distancing. Our numbers are low, but it's because we've worked very hard at it. So I think just the vigilance on the messaging is very, very important. And hopefully that trickles down into your, with you and your employees and your community and the schools, how important that is. I think the best thing to maintain the balance is to show the success in the models that we've had and just try to educate people to that model. And hopefully the government can't force a long-term changed behavior. We can do short-term change behavior with some of our actions, but it's really incumbent upon individuals to change their behavior for the long term and have the discipline to do so. So we can keep the message elevated, but hopefully over time and in practice, we're at a place where wearing a mask. I don't leave my house without a mask, right? Because I'm not going to be able to walk into a grocery store or a restaurant to, pick up food or whatever it is. So that's a changed behavior that's become second nature to us. I think back in March, we would have thought that was, wow, are we really going there? But now it's completely second nature. It takes a little time, but we've gotten there. But change behavior is an important part of it. And that, from my perspective, I think it starts with the right message out of leadership, and then hopefully providing the flexibility at the local level to have those guidance pieces in place without being so restrictive that it drives people away.
That makes sense. So I'm curious, so we kicked off our Leadership Greater Nashua program in September, kind of like Leadership New Hampshire, but it's for our region. And for each of the session days, they have one session a month on a different topic. I've had to intentionally say to speakers, like, we're trying not to focus this all on COVID because It's easy to do that right now, especially we have Healthcare and Wellness Day next week. And so, it's especially tempting, but I think it will serve these participants better long-term to know broader knowledge. And so outside of COVID, what else are you focusing on? What else is the state looking at and prioritizing? And I'm sure that's hard because it's all encompassing, but life goes on and things in the background.
So, I mean, we really, you're right. We talk COVID all the time, but we have not taken our eye off the ball in terms of the SUD crisis, right? I created a new system called the Doorway. which is better and more thorough rural access to care in terms of folks that are struggling with opioid or drug substance misuse. We have our 9 hubs across the state that what those really do is, what I designed it to do is make sure no one has to go more than 40 or 45 minutes away from their home to get a full wraparound services. You don't have to go into downtown Manchester anymore. And we want to take that model to the homelessness, that model for DCYF and abused kids, that model for the DD community, which is already there in some aspects, but we just want to make that model a little more efficient. So again, it's not about a centralized system. It's really about that rural access to care. Community-based care is really the way you go. And so some of that has been, I mean, the mental health, we inherited a disaster with mental health in 2017. I'm not going to relive those nightmares so many folks have. You know, we got the number of folks, for example, waiting in emergency rooms to get into a bed just prior to the pandemic was 0. We didn't have any. We got it was at 90 and we got it down to 0. We had a system that was working really, really well. Folks were getting the care that they needed. And then the pandemic hit, and that issue of isolation, especially with kids, and especially a lot of workforce retreated. They kind of went, I can't be in the workforce for, as we talked about, maybe they were older or they had underlying health conditions, and that's understandable. But that meant the whole system kind of came to a bit of a logjam again. And so we got to get back to what worked. And we've shown our model around mental health does work. We got to really make sure that we're fulfilling and getting back to it. You know, we've put a lot of RFPs and stuff like that. Some businesses that want to help in those worlds aren't really doing that right now. So COVID has really affected not just on the government side, but on the private sector side and the nonprofit side that we rely on to provide some of these services. They just don't have the workforce either. So it's kind of a two-way challenge. And at the end of the day, the citizens are the ones that are suffering, right? They're the ones that aren't getting those services. So those specific areas, DCYF, mental health, SUD, and the DD community, those are kind of 4 areas where we really put a lot of our emphasis, because during an economic crisis, during a pandemic, those are the areas that get exacerbated the most, right? Folks maybe were in a good recovery program, but then couldn't come in to do their recovery program and they're isolated, and they were getting a couple $1,000 a month, even though they didn't have a job. And unfortunately, that led to a lot of folks to either relapse or go back into drugs, turn to drugs or whatever it was. So we're trying to get those folks back re-engaged in the system that was helping them back on that path. We have a lot of folks, you know, with our recovery friendly workplace program, we have hundreds and hundreds of employers now that are deemed by the state, a program I created called Recovery Friendly Workplace, where we teach the employers how to work with employees that are going through recovery, how to keep them engaged in the workforce so that, you know, they're not losing good employees to substance misuse, and they can get them back or keep them as part of that program, because it's so important for that individual's path. It's important for the business to retain them because they've made an investment in training or whatever it might be. And so those types of programs are not gone by any means. We're doubling and tripling down. It's just been more of a workforce issue than anything. And then finally, the budget. The budget is obviously a very, very big one. We're not going to have those massive budget crises that other states have, but we still have to manage it, to be sure. And so we're putting a lot of emphasis behind the scenes, either with hiring freezes here, or we're not stopping programs. I can't cut programs. That's not what we're doing. But we're just spending a lot of time finding efficiencies or duplicity that existed in one department to another. And so the pandemic has created the opportunity to go in and dig a little deeper and find some of that. And we've increased the amount of money we lapse back, that we're not spending lapsing back without cutting programs. I think that's just, again, something I had to do as running a ski resort. You know, I didn't have pandemics running a ski resort, but sometimes God didn't give me any snow. I mean, it was just devastating, and you had to make some really, really hard decisions and find those efficiencies. And we're just kind of taking some of that mentality and skill set into the public sector.
Very interesting. So we have some questions, and please, those who are with us today, keep the questions coming. So they often say New Hampshire is much like 2 different states, North Country and Southern New Hampshire. That said, will you enlighten us to some distinct differences that the North Country non-COVID experiences as it may relate to economics, education, demographics, housing, etc.?
Sure. I think New Hampshire is like 220 different states, because we have 220 cities and towns, right? And local control is key and paramount. But the point is very well taken. Our socioeconomic dynamics are very. We have a rainbow, if you will, between. And I was up at the Buck Rub Pub up in Pittsburgh yesterday having lunch, and I was down in Seabrook the first thing this morning. So the beauty is we can get across the state very easily. We can have a great one-on-one connection with a lot of the city and towns, the leadership, the businesses, but we are very different. So the pandemic has really hit the southern tier of the state harder than anyone else. We know that. Nashua, Manchester, that economic corridor down to Boston, a lot of those commuters early on in the pandemic in March and April, that's a lot of where it was coming from. As the numbers continue to rise a little bit, we're seeing it more. I think Colebrook had a bit of an outbreak just a couple days ago. So where some of the healthcare for the long-term care facilities might be, there was one up in Warner, right, very rural, beautiful town of Warner. There was a long-term healthcare facility that had a bunch of cases that we had to deal with. So the reason that even though those are long-term care facilities in rural areas, the staff is still coming and going, right? They're still going to the grocery store. And so as the staff might get infected, it can kind of domino effect into those communities. Well, we're really seeing that now. And as our numbers rise, we're seeing a little bit all over the state. COAS isn't immune to the virus by any means. So, I was very hesitant early on because we just didn't know what was coming to start doing, well, this county's here and that county's there and all of that. As we go forward, if we had to take a more restrictive approach to business, we could definitely do it more regionally. We just have more data and understanding of the virus to say, well, Rockingham and Hillsborough, you guys are really at the tip of the spear. We got to make different accommodations here than and maybe more flexibility up in the North Country. We started doing that around restaurants early on. If you remember, that was the first guidance flexibility we provided, where I think restaurants in 6 different counties could open fully, but the other 4 counties were still at a bit of a limited capacity. We could take that restrictive approach again if we had to. If cities and towns want to do mask orders and all that, we're very supportive of that. I haven't done a statewide mask order because, again, still half the towns in our state have no COVID. Half of them have absolutely no COVID whatsoever. So it's hard to tell half your state that they absolutely must wear a mask when, by the way, we're wearing our masks. They're already doing right by themselves and right by the state, and I think everyone, for the most part, is doing a good job of maintaining that personal responsibility. We have to keep it up, of course. So we can take a more regional approach to things as we move forward. Hopefully we won't have to, but it's definitely a tool in the toolbox if we have to.
For sure. So from one of our other participants, so what do you think we can do to build more workforce housing? The lack of any housing is a major problem here in Greater Nashua.
It's a huge problem. It's something we've been talking about and I think bringing some real action to over the past year and a half. Obviously, again, the pandemic threw a wrench in some of that. I put forth what I believe is one of the most aggressive workforce housing bills that the state's ever done. Now, the pandemic hit and it wasn't able to have a public hearing. So we're going to bring it back. It was very bipartisan. I had a Republican and I designed the bill myself, but I had a Republican and Democrat sponsor. And what this would do is a variety of things, but it would really provide incentives, not kind of the carrot, not the stick, but incentives to local communities and businesses through tax credit programs that are willing to partner and make those investments in workforce housing. Businesses need workforce housing. Towns need businesses. So therefore, towns need to be permitting this type of project. And it's the permitting process that we found is really the most detrimental here. You have certain towns that just don't want any housing, any workforce housing. They don't want apartments or whatever it might be. Now, we've pushed that message and we've gotten some of them to come around. Some of them have been great. Rochester and Londonderry. I mean, there's a pretty good list there of towns that are very good about making those investments. We still have about a 1 or 2% vacancy rate. So if you build the product, it's going to get filled. The economics will work, but you got to get the towns to permit it and not drag this stuff out for years. And there are a lot of towns that still have old school thinking. I'll call it 1995 type thinking. We don't want young families in here. Look, if you don't get the young families, you're not going to get the businesses. If you don't get the businesses, you're not going to have the tax base. You got to understand that a school, everyone's worried about the drain on the system and services. Well, let's look at schools. That classroom, whether it has 23 kids or 18 kids, costs just about the same to operate. But you're getting much less dollars into the system with kids, with less kids in the classroom. And so as the number of kids in the classroom continue to decline because millennials and Gen Zs, they're having less kids later. That's just a fact. So as you get less kids over time, a 3 or 4% drop in school population, and then you have the pandemic and a lot of kids going to fully remote or homeschooling, there's just less state dollars coming into your town to pay for education, and that creates a big gap in the education. And then more of the general fund dollars within your cities and towns now have to go to supplement that. So that has a domino effect. I cannot lower property taxes in the state. The state's just not allowed to do that. But I've sent more cash back to cities and towns than any governor in history, right? Nearly $200 million in pure cash, whether it's in roads and bridges, clean drinking water infrastructure, safe school infrastructure. No one had ever done that before. Hundreds of millions of dollars have come back. And then you add all the CARES Act money on top of that through this pandemic. So the money is not the issue right now. It's just about creating that opportunity. Now, those young families, they want to be here. They want to be working here. Those businesses need the workers. And whatever we can do to incentivize more of those communities to creating that housing. The example I give a lot, I always tell people to go to Walpole. Walpole's a beautiful town, way out west, very charming town, beautiful little town. And they created a workforce housing project, a very successful one. Now, when you drive through the town, you wouldn't even know you drove right by it. But it looks like a beautiful red barn out there, and the architecture is really beautiful. But when you go inside, it's clean, it's sustainable materials, it's affordable, it's workforce housing, it's just for teachers and nurses and whoever might be in that community. Everybody can afford it, and it's been very, very successful. I'd like to take that and multiply it by 200 and put it all over the state, but we need the expertise and that door open mentality from the planning boards and the folks on the city or town level, and we think that can come with some better education and training on what 21st century workforce housing looks like, and a little more incentive through the tax credit program to incentivize the businesses to work directly with those town leaders to get these types of projects done. The vacancy rate says that the economics are going to work really, really well. The business need is there. Young families are moving in here. They want it. We need the local folks to open those doors and I think just be a little more and a little easier to get that stuff permitted and move it forward.
So interesting. It brings me back to my stay, work, play days stigma was something that we dealt with, right? Like when we talked about housing. Even this week, we had a virtual event with the interim president and CEO of the Greater Nashua Mental Health, right? And we talked about stigma there. Like there's so much sort of the connotations that come with workforce housing that isn't necessarily what it is anymore, right? But people still sort of have that.
This is not 1975. I hate using the term Section 8, but that's what it was. It was called Section 8. That's so old school. That is not what we're talking about. We're talking so a teacher has a place to live in her own town. It's that simple. And her husband and her kids or whatever it might be. And, single moms just don't have to drive 45 minutes just to work at wherever they're going to work. They can live in their communities because we believe in local control. So let's have the locals that are in our community be able to live in our community. I mean, not to state the obvious, but it's really that important. And the businesses really have to be a part of that. If a business is frustrated because they can't find workers, I would ask that business, how many times have you gone to the planning board and been a champion for new housing in your community? Because that's probably the biggest reason why you can't find those workers. You're one of the biggest, if you're a business, you're one of the larger taxpayers in your community. That's just the way that taxes usually work in most cities and towns. So be an agent of change that you want to see. Be a little bit pushy, be a little bit demanding, because your employees and the product you're creating is counting on you to be successful, to be an advocate for better housing. And again, I think with this bill, if we can get this done, and I think we're going to in this coming session, creating these incentives, I think it's a real opportunity for folks.
All right, so we have a related question. Is there a plan to tier workforce housing in some way? Many young people don't qualify for workforce housing, but struggle to pay the high rent costs. Is there a plan to expand the program to a tier style system down the line to open it up more, thus creating more opportunity to keep young people in state?
Absolutely. I think it's a really, really great point that I forgot to bring up, but having it, let me take a step back. What millennials or in the Gen Zs and the next generation, the gig generation, I don't know what they're calling the next generation now. It's always a different hashtag, but what they're looking for is very different than what even my gen. I'm fairly young, 45. I'm not an old man yet. The hair's falling out, but I'm not an old man yet. But even what we were looking for at that same age is different. It's a different kind of product. That generation is more adapted to more communal type living, smaller spaces, but more communal. They're not looking for 2 acres and a white picket fence necessarily. That might come down the road. So if cities and towns are saying, yeah, we got more housing here, and it's all, $600,000, 4-bedroom homes, you're building the wrong product. You're building it the wrong way. You're making the wrong investment. And so, yes, we need a tiered kind of a gradual incentivized system. So it's not just all the same product. And that those tiers also might look different in Bedford and Manchester than they do in Colebrook and Newport, right? So we need some flexibility at the local level. And part of the bill that I was referencing earlier brings that education, if you will, to those cities and towns, and kind of gets them up to speed on the data, on the dynamics, on how to permit. Most of our planning boards are volunteer boards. They don't always have the best expertise. They're passionate. They want to be on the board and serve. I think that's awesome. My dad was on the planning board in Salem for a while. He was an engineer, a professor at the time, and he didn't know much about planning, but he was an engineer and loved the town of Salem and joined the planning board back in the 60s and the 70s. So that's typically how we do it, and that's a great system. But sometimes it also comes with the education of, here's the new products that are out there. Here's some models of workforce housing. Here's the different tiers that you got.
Oh, I think we lost the governor. Let's see if he'll come back. It's always hard to tell with these Zooms if it's on my end or on the other end, but we'll give him just a minute to pop back on. In the meantime, if you do have questions, we have plenty of time if we get him to come back. So please submit them in the Q&A box at the bottom of the screen. Actually, while we're waiting, I'm going to hope that this is okay. Bill from Oracle, I'm going to put you on the spot and just bring you up here for just a moment. Bill, if you don't mind unmuting yourselves and introducing yourself. Oracle is our presenting sponsor for today. So we would love to just hear a couple words from you about the organization.
Sure, thank you, Kate. I'm Bill Callahan. I'm the Director of Facilities for Oracle for the New England region, and we have a very large presence in Nashua. And we're glad to be a partner with the Chamber and very supportive of the Chamber's efforts, and specifically with the Governor. We've had to keep our operations going to keep our customers happy with their software services. And he was instrumental in getting us sort of the PPE we needed to keep things going and keep people safely in our offices while our supply chains were really stretched and we were unable to procure those items. So I think it's a very timely presentation, and thank you.
Awesome. Thank you so much for your support. We appreciate it. All right, folks. Well, so someone let me know there's a Comcast outage in Manchester, although that's where I am at the moment, and I'm still connected up. Here we go. Looks like he's coming back in. That's what 2020 is all about, right? Rolling with the punches and learning how to pivot and think on your feet and all of those different pieces. So that's what we're all doing in so many ways these days.
Ta-da! That means the powers that be thought I was rambling on too much about housing. Sorry about that. We just had a power failure here, so we just had to go to battery really quick.
Right. And I said it's just 2020, right? We think on our feet and we roll with what happens. And
all good. Thank you. I'm sorry for apologizing.
Well, so let me bring in another question. So you mentioned the upcoming legislative session. So we have a question. What can you tell us about how the legislature will meet and work through the submittal, presentation, and review of legislation this coming year?
Great question. So my sense is the legislature is going to be back in session. I don't know whether it's going to be Republican or Democrat, so let's throw that aside for right now. I know which way I'd like to see it, very business-centric Republicans, but they'll likely meet outside of the State House. I think they'll be able, they may have to be a little better about managing their time. The last 2 years, they just haven't been very good at that at all. And you get all this crunch towards the end. We saw that in 2019. And then during the pandemic, we just had to throw a whole bunch of bills out, basically. So they're going to meet, they're probably going to meet over either at SNU or maybe at UNH. I'm really not sure what that will look like. But if they can get a schedule, they should be able to take up a lot of legislation. They should. They might have to be a little tighter if their schedule gets limited because of that. I think the Senate will be in session back on the Senate side of things. And then our executive council schedule, is not going to get affected by the pandemic. We can manage, we managed through the pandemic with our council, and we'll continue to do that. So I think I can't speak for the legislature other than to say that they may be a little more restrictive about the bills that they have time to take up because their schedule might be a little more limited. But I think there's going to be a lot of the stuff that we didn't get done, not the vetoes and all that. I think hopefully we're beyond all that nonsense. But some of the bills that just didn't get a public hearing last time, a lot of the things that we had to veto were things that just didn't get a public hearing, right? We had these big omnibus bills, if you remember. They were like 40 bills, sometimes completely unrelated, shoved all together. And they were good things. They were good bills that I ultimately vetoed because they were part of this giant package. And there was just too much bad stuff with the good stuff. And there were certain bills I signed that with stuff in it that I really didn't like. But there was too much good stuff, more good stuff than the bad stuff. So a lot of that stuff we might have vetoed will come back. But that's primarily because it just didn't get a public hearing. And I do believe that unless it's really paramount, things really have to get a public hearing and a public shake with the legislature. It's a great process. It's a very large body. It's a very representative body. And I think they have to be involved in that. With the, I get a lot of questions about the stay-at-home order or the emergency order, the state of emergency. A lot of the orders as part of the state of emergency will likely also be taken up by the legislature, right? I mean, I just had to do what I had to do. We had to move forward and we had to make very, very quick decisions, and I think we did very well with it. But things like telemedicine or stuff like that, I think is really great, and I want to see that more permanent. And I think the legislature will be able to take a lot of my orders, turn them into more of a long-term legislative process. Some of the flexibility with the state of emergency will have to remain in place. The fiscal, being able to move dollars very quickly. But other than that, I think a lot of it can be taken up by the legislature. Was that your question? I think that's what you're getting at.
Yep, I think that was perfect. So another question from an audience member: have we seen a large economic impact from the closing of our border with Canada?
Yes. Yeah, I mean, if you're moving product or you're for work, I was just at a business called Deflex yesterday up in Berlin. They're one of the first companies I visited when I went to Montreal a few years ago. And they were thinking about coming down, and sure enough, they did. They expanded into the United States and into Berlin as part of the Buy America provisions that the administration put forward, and it was great. They're hiring Americans and creating the products for American manufacturers here. And I asked them, can you still go back and forth? And they said, yeah, no problem. They and their workers can go back and forth to see their families. If there's, I think the managers are still from Canada. Most of the workers are New Hampshire workers. But if they have to go back and forth for work, it's fine. But the real impact is tourism. If you're coming back and forth for recreational purposes, right now that's prohibited. And so some of the tourism dollars we would typically see come back down into New Hampshire were very restricted. Now, we still had a very robust tourism season, without a doubt. I mean, the ATVing and everything you saw up in the North Country was just booming this year. North Conway was packed. You couldn't keep stuff on the shelves. If you were selling ATVs or you're selling snowmobiles now, you're doing very well. You just can't keep it on the shelf. So luckily, it wasn't so impactful that it's created a negative force. I was up in Errol yesterday as well at LL Cody's, and they sell a little bit of everything there, and they said they've had one of their best years ever, which is terrific. But yes, the tourism impact is the biggest thing that we saw over the Canadian border.
And it was such a beautiful foliage year.
It was.
All right, so this is a little bit of a longer one. Our employees will be gathering for the holidays, and some will want to travel outside New England. Current New Hampshire guidance requires a 14-day quarantine without a test out option. In your next guidance publication, can you explain why an employee can't test out the day they come home, so we're not the bad guy when we have to deny discretionary travel PTO and require a 14-day quarantine?
So we are looking at making some changes, but I'll tell you, as soon as you get home, you can't test out, and this is why. When you travel home, it can take 3 to 5, sometimes 7 days for the virus to actually be in your system to the point where it's detectable. So if you, let's say you were to come home on a Sunday and you go and get a Binex test and the antigen test says you're clean on Sunday, you know, you're negative. But if you had contracted the virus Thursday, Friday, Saturday, Sunday, you're probably going to be negative. So then you go back to work and all of a sudden you're not feeling well, or other people aren't feeling well, and you realize you've just spread it to 5 coworkers Monday, Tuesday, Wednesday, Thursday, because you thought you were all fine. So it's more of a function of the virus than anything. Sometimes it takes, 3 to 7 days for you to be able to what we call shed the virus. And when you can shed the virus, that's when it becomes detectable, and that's when you can give it to others. So you do need that waiting period. Now, we're looking at, do you need 14 days? No, probably not. But, Dr. Chan and I are looking at some of that data now. And if we can make some more flexibility there, so it's not such a long period of time. But just, I traveled, I took a test, I'm clean, I'm good. That's not going to fly. What we'll probably do is just get that quarantine period down a little longer. But we do allow travel outside of New England for work without the quarantine provision, for being essential workers and all of that. Or school, but for recreational purposes, we're really encouraging people not to do it. And if you do, you do have to go through the quarantine process. The COVID's spreading everywhere. It really is. And it's not just where you go, it's the act of travel. You're on a bus, that's very risky. You're on an airplane, that's very risky. You're flying to a wedding, that's very risky. So it's a lot of times it's the act of travel, as well as some of those larger gatherings that people are going for. That causes the most concern, and that can lead to the most aggressive viral spread.
And their choices, right? If you choose to leave, then here's what you have to do.
That's right. That's absolutely right.
So health insurance is the #1 concern for many families today. The high cost of premiums, deductibles, prescription costs with decreasing benefits are problematic even if you do have health insurance. How can you and your administration help the residents of New Hampshire?
So I've been able to lower premiums by over 20% this year alone. You're going to see premiums on the private market drop, I think it's about 17 or 18%. I think last year they dropped 10%. There's a couple things contributing to that. One is we're just being much more aggressive on preventative care. And when you're more aggressive on preventative care, less people are coming in for the crises or the very expensive emergencies down the road. They're just maintaining better health for themselves. They're seeing their doctor on a regular basis. That actually results in lower premiums to you on private health insurance. We're creating more competition. And by that, I mean like the urgent care centers, the convenient MDs, the clear choices, whatever they might be. So not everything has to be an emergency room visit. That can be very, very expensive. So we're creating more low-cost alternatives, community-based alternatives, as opposed to running to an emergency room. We're now ranked #1 in the country for transparency with our healthcare plans. A lot of other states, it's really hard to figure out what plan is which and what you're getting. We're actually really, really good at of mandating transparency in your healthcare plan, which just allows better education and allows people to have more choice, more competition, which drives prices down. And then also on the competition side, we're very aggressive about plans, insisting that our plans have, they have like the app, where you can see, you need to get an MRI. Well, you can see here's the 14 places within 50 miles where I can get the MRI, and here's the cost of each. And so allowing people better choices, more information to make better choices for themselves, creates competition in the market, which ultimately also lowers costs for the individual. So that's all kind of part of it there. And again, we've gotten a couple more insurance companies to come in. We're not back to and I don't know if we'll ever be back to the late 90s when we had 10 insurance companies here. They made some bad policy decisions, frankly, in the late 90s that drove a lot of companies out. You have companies that kind of cornered the market, and Anthem does a great job here in New Hampshire. I'm not knocking Anthem at all. And they stayed with New Hampshire when other insurance companies left. And they have a big piece of the market, as does Harvard and a few others. But I think what you're seeing now is a reduction in premiums, better choices with individuals, more preventative care, which is reducing the larger and more expensive cost items on the back end. And overall, I mean, healthcare, when it's driven by Washington, is not a free market, which means prices do not go down naturally. Healthcare, when you allow more of those free market concepts come into play, can drive prices and premiums down. And we've seen it over the past few years. We really need to keep it up.
All right, so final question, and I tend to like sort of the person-centric questions. So as Chris Sununu, not as the governor, what have been your silver linings, or what have you done differently for self-care during this time? Like I'm sure that it's very minimal, but I'm sure that there are little pieces if you think about it. What comes to mind?
Well, I say it all the time, and I'm not lying. I basically I've been living on chocolate and coffee. So self-care hasn't been ideal. I'm not exercising as much. You know what I started doing the other day? I'm really into Halloween decorations this year. Like, I'm finding my thing, just like we all are. We're finding something new to take our mind off the anxieties or the stresses. I can tell you in the past month, late at night, like 3 in the morning, I'm up, making tombstones and all of this, just like my arts and crafts. So I guess if anything, I'm getting a little more crafty, a lot more, late night home projects, which I know keep my family up when they hear my saws going in my garage or whatever it might be. Just a lot more home projects. That's kind of my stress relief, if you will. And that's my mental care. I've gained a little weight. I've probably gained 10 pounds over COVID. I'm not up to the COVID-19 yet, but I have probably gained a good 10 pounds. So, and the stress has been hard. I'm not going to lie. There were a lot of late nights. I don't know. I think the mental health aspect of this crisis is what is bearing down on all of us a lot. The isolation, we're innovating, we're getting by, but we're not a state that just wants to get by, right? I think it's terrible, that so many kids have to do remote learning. I was with some families, not to take us off topic, but some families that are in Manchester. Their kids are remote learning, but they don't speak English. The parents don't speak very, very good English, if at all, sometimes. And so they really can't help their kids, their second and third graders, through remote learning. So you have this big divide. That opportunity gap is getting more and more split, and those kids feel like they're getting isolated even more. And so that's the type of stuff that I think is creating a lot of anxiety in our families and at home. But 2020 has been terrible to all of us. So we all have to kind of find that path forward. I keep telling myself I'm going to go on that diet as soon as the election's over. Maybe I'll do that. Maybe things will get a little less stressful, but we still have a lot of work to do. There's still long hours in the day. I really haven't been campaigning much at all. I guess that's kind of a good thing, because it's a 20-hour-a-day job, but that's fine. I'm still young, but not young enough that I shouldn't be, taking probably better care of myself. But this is vitamin water. No sugar vitamin water with a shot of emergency in it.
Perfect.
Not really.
From the coffee. Well, thank you. Certainly, we appreciate the long hours, the late nights making Halloween decorations, all of that you're doing on our behalf. And thanks to everyone who joined us this morning. And again, to our sponsors, our presenting sponsor, Oracle, Bank of America, Eversource, Bellwether Community Credit Union, Citizens Bank, Enterprise Bank, and Northeast Delta Dental. But certainly, most of all, to you, Governor, we appreciate you being with us this morning and all that you're doing. Thank you so much.
Well, hey, thank you for the opportunity. You guys know where to find me as we come up. Just stay disciplined, and we'll get through this. Just be safe day by day. We just got to take it safe.
Absolutely. Thank you.
Thank you.
Goodbye, everyone.